for everyone to watch as well, so I think we can get started. Thank you so much to everyone for joining. A couple of quick reminders. If you're not speaking, please put yourself on mute so we don't get a lot of background noise. I can hear myself echoing on someone's mic, so I'll find you and mute you. So yeah, and if you have questions along the way, Kathy's going to be moderating the chat. So just put them in the chat, even if they're general or to a particular speaker, please do put them in the chat. Great, so hi everyone, and welcome to our roundtable discussion entitled One Pill Too Far, discussing the UK's response to antimicrobial resistance. I'm Rhiannon, I'm Policy and Advocacy Director at Students for Global Health, who are convening the roundtable. Students for Global Health is a UK-wide youth organisation focused on achieving health equity, both for people in the UK and globally. We have 36 branches across the country who work on advocating and educating on health equity and global health in particular. So as part of Antibiotic Awareness Week, Students for Global Health are hosting this roundtable, which focuses particular on the UK's role in AMR from a One Health perspective. So the aim of this roundtable is to bring lots of our members together to help to understand this issue and also to discuss what some of the organisations and people who are leading in this field who have thankfully joined us today are doing to encourage work on AMR. So to give a brief introduction, One Health is very much on all of our minds as we are in the middle of what can definitely be described as a One Health crisis. So One Health is, I'm sorry if any of the speakers have to correct me later on, is the concept of looking at health from a much wider perspective to the way that we normally do. It's a view of health that looks at our relationship, not just with each other as humans, but also with the environment, the animal world, and the wider way that we live sustainably with our environment and our populations. And antimicrobial resistance, AMR, is an ever-increasing problem and a kind of slow burning but very upcoming health crisis, which, as we'll discuss on this call, doesn't get nearly enough of the attention and investment that it deserves. So thank you very much for joining us at this very important event. We're going to be discussing the issue, but not just kind of discussing and talking. We're also going to be thinking about ways in which we, and especially young people and young health professionals, can be involved in these decisions and can start influencing the outcomes in a positive way. So before we launch into the full discussion, I wanted to hand over to Lord Trees. If you could give a brief introduction to yourself and also your work on the APPG. But if you could importantly, I think, tell our audience why it's important to take a One Health perspective on AMR.
Thank you very much, Rhiannon, and thank you for the invitation. It's a pleasure to be talking to students again after a few years since I retired. I'm a veterinary surgeon, and I spent most of my career in academia at Liverpool, University of Liverpool, in the Faculty of Veterinary Science. But for 25 years, at least of that, I was based in the Liverpool School of Tropical Medicine. So One Health runs in my veins. I mean, I was doing it before I realized it, really. So it's a pleasure to speak to everybody. I retired from the university in 2011, but entered the House of Lords, so-called People's Peers, through the Appointments Commission in 2012, and I'm an officer of the APPG on antibiotics. I'm actually the treasurer. I'm very ill-suited to be treasurer, but I didn't happen to attend the meeting, so I got lumbered with the job. It's an old joke, but it's actually true, and I can blame Nick Brown, I think, for that, maybe. Anyway, so I think I'm the only vet on the sort of panel. So I apologise, I have to go to a Royal College of Veterinary Surgeons meeting at 6:30, but I'll present some things, facts from the veterinary point of view, because they may not be made later in the talk. I'll concentrate on the UK situation, as the heading says, but a couple of global points, really. First of all, there is totally inadequate control to access of antibiotics globally in many countries, both for animal use and human use. That's the first point. And there needs to be much more regulated control introduced in many low and middle income countries. The UK has had a prominent role to play in AMR, and I think can claim with some justification credit for drawing this to the global attention of politicians and so on, with the instigation of the O'Neill Commission by the Cameron government and the advocacy of Dame Sally Davis when she was CMO. And O'Neill reported first in 2014 it was. I would just point out what's, I'm sure, apparent to everybody on this call, that AMR is antimicrobial resistance. And whilst all bacteria are microbes, not all microbes are bacteria. And a point the O'Neill Commission made in its first report was to quantify the magnitude of AMR. And it produced some pretty alarming figures that if we did nothing by 2050, there would be 10 million deaths a year in globally, and it would cost economically an estimated $100 trillion, by 2050. Now, I would just point out that that was an analysis which included the totality of AMR, so it included HIV resistance, malaria resistance, and TB resistance. And I just have to point out that none of those has a veterinary dimension. So, you know, veterinary use is not implicated at all in those problems. Having said that, so I'm going to concentrate on antibiotic resistance or antibacterial resistance, which does have a veterinary element, obviously, and is a real One Health issue. Another fact that we all need to just remember, because it's often said that the EU has banned the use of antibiotics for growth promotion in animals since 2006, and that ban will continue, of course, post-Brexit. In the UK, there has been, particularly since O'Neill, a very dramatic and I have to say successful campaign to reduce the amount of antibiotics used in animals. And today, because it's part of World Antibiotic Awareness Week, there have been two reports published, one from the Responsible Use of Medicines in Animals, RUMA, and one by the VARS report, which quantifies veterinary use from the Veterinary Medicines Directive. I'm going to mention a bang up to date. Since 2014, there's been the amount of antibiotics used in animals in the UK has halved and is now well below the O'Neill Commission's target they set for animal use of 50 milligrams per kilogram. It's now 31 milligrams per kilogram on average across all animals in the UK. And the use of highly important, critically important antibiotics has dramatically fallen. And it's at the level of 0.17 milligrams per kilogram, a 72% reduction since 2015. So that's very welcome. So the levels of usage, the last comparable figures I think that I've managed to find were published in 2018, but human usage in the UK was in gross tonnage of active was 491 tons, and in animals 232 tons or thereabouts. So animal usage in the UK in total tonnage going into the environment is less than half that usage. The major use in animals is with pigs and poultry. That's over half the amount being used. And in other species, it's relatively small. It's been dramatically reduced in aquaculture, for example, partly by the introduction of vaccines and so on. And that's been a terrific success there. And there are differences in the classes of antibiotic. In animal use, tetracyclines are the major type. In humans, it's the penicillins. So there are differences there. And those reductions in usage have been associated with concomitant reductions in resistance being detected in sampling techniques, both of clinical isolates and environmental and non-clinical isolates from animals at slaughter. The last point I would just make as well is, and it's opposite, I'm going to a Royal College meeting in a minute, but the Royal College introduced, in fact, several years ago in its guidance for professional conduct, that the responsible use of antibiotics was a responsibility of and basically hinting that irresponsible use grossly could be a professional misconduct issue. So I hope that gives you a quick run through of the situation in animals. There's been huge progress made, and there's a new set of targets being agreed for the next stage within each sector, and new targets to reduce and also monitor resistance. So thank you for that chance to present that, Rhiannon. Thank you.
Thank you very much, Lord Cheese. That was fantastic. And yeah, I think as Lord Cheese has said, it's a very fast moving area with lots of different people involved and lots of things changing. And we've had that kind of spotlight on the animal part, but there are lots of other dimensions as well, and that's what lots of the other speakers are going to talk about. So if I could, I'm just going to run through each of the speakers, and if you could give a very brief overview of who you are, what your organization is currently doing, so which part of this map are you part of, and if you could do one thing to improve AMR, so you've got a magic wand and you can do one thing, what would it be? So I'm going to start with Chris, if you'd like to start.
Yes, thank you. Thanks for the invitation and thanks for being here. Well, I am Chris Pinto. I am a veterinarian from Peru. My background focuses especially in microbiology, and I have experience in zoonosis, AMR, and One Health. I am currently working at the London School of Hygiene and Tropical Medicine as a research fellow and conducting a systematic review of watch and biosecurity interventions in animal agriculture to reduce burden of infections and antimicrobial resistance in people, and working and living with animals in low and middle income countries. Well, as working at LSHTM is a big institution, they are leading in research and they are working on various initiatives to understand the mechanisms behind AMR, how genes are disseminated amongst bacteria, and also they work with organizations and international institutions and governments to gather information or evidence on interventions that are useful to tackle the AMR problem, and that's useful to inform policies and develop models to find a solution for this problem. Our work has a strong emphasis in One Health, integrating research on humans, animals, and the environment, but also because One Health, it's also about interdisciplinarity. One Health, it's including different aspects of a problem, like something that sometimes as working medicine, we don't think about, like social aspects, economical, cultural aspects that are important to this issue and that are going to affect any measure that we are suggesting. So that's what it's important to include One Health. And LSHTM have different professionals there working together. So I think that really it's really good for research. Well, I would say, like regarding the one thing I will do, I have to say that that's a really tricky question, because as someone said one day, I think was someone from the World Bank, that AMR is a wicked problem. So I don't think there is just one thing that you can do to solve it. I think we have to attack the problem from different angles and find different solutions, try to see if, not just thinking, for example, if we are looking at raising awareness among people to reduce the antimicrobial use, excessive antimicrobial use, we have to think about how these people are going to change. Not just being aware of the problem makes you change your behavior. There is not a direct relationship in that. So we have to provide people an environment where they can actually change their practices. And if we are thinking of them not using antibiotics, well, we have to maybe improve healthcare for them so they don't want to use them.
Yeah. Thank you. That's a really great introduction to your work. Suzi, could I pass it over to you to do a quick intro?
Yes, hello. Thank you for the invite to join the panel today. So I'm Suzi Shingler. I'm the campaign manager for the Alliance to Save Our Antibiotics. We are a campaigning organisation made up of the Soil Association, Compassion in World Farming and Sustain. And we advocate for healthier farming systems to reduce the need for antibiotic use. We are an EU-wide campaign. We've got 65 members. About half are medical groups. So it's the European Public Health Alliance, the Royal Colleges of Physicians and Pathologists, and the College of Medicine. And then we've also got some civil society and more animal health focused groups, such as Greenpeace and Friends of the Earth, the Sustainable Food Trust. So we're a good group, and we really are trying on the One Health side to bring the human medical side together with the animal health side. We've been a campaigning group for about 10 years, and I think 10 years ago we were looking at a very different policy landscape on this across Europe and in the UK, and a lot of good change has happened since then, but there's still a lot of work to do. And it's really nice to see actually the One Health term being used much more prominently now. So yeah, thank you, that's me.
Perfect, thank you. If I could pass over to Sian, please.
Thanks, Rhiannon, and hi everyone, good to be here. So my name is Sian Williams. I'm the Policy and Advocacy Advisor for the Drug Resistant Infections Programme at the Wellcome Trust. So for people who aren't familiar with Wellcome, charitable foundation that supports science to solve urgent health challenges that face everyone around the world. So have a very global focus, but work in the UK, so also deal quite a lot with UK issues. We have a dedicated programme focused on drug-resistant infections where I work, and over the last 4 years we've invested over £175 million in that particular programme, as well as wider research funding that Wellcome awards across the board. So our particular programme on AMR has 3 priorities, and we particularly have a human health focus, but we do look at things from a One Health perspective, so that's particularly important to us. So the 3 things we're focusing on at the moment are development and access to therapeutics, also appropriate use of antibiotics, and the last one is national action to achieve maximum impact on our plans to tackle AMR. And so it was that last question on if I had a magic wand to tackle one thing on AMR. It's definitely a really tricky question. There's a lot of things that I would want to do, but I think in the spirit of World Antimicrobial Awareness Week, actually similar to Chris as the first speaker, I think I would make it so awareness of the issue directly leads to changes in behaviours. That's something that people assume, that awareness will directly lead to impact and change and good progress, but actually that's just not the case. Yeah, awareness would lead to change, and our World Antimicrobial Awareness Week would have even more impact. So yeah, that would be my one thing.
Thank you. I think that's a really good point. I also like how you raised the issue of access and kind of the double-edged sword of overprescribing, but also lots of people not actually having access to antibiotics in the first place. So I would like to hand over to Nick, but I can't see him. Do you have your video off, Nick? And are you able to turn it on?
Yeah, I'm here. So thank you again for asking me to participate in this. I'm Nick Brown. I'm a consultant medical microbiologist, and I work in the hospitals in Cambridge, as does Rhiannon. And I'm here, I guess, mainly through my work through the BSAC, which is the British Society of Antimicrobial Chemotherapy, which is a professional organisation and also a charity dedicated to improving the use of antibiotics and hence improving outcomes from the treatment of infection. The society is about 49 years old, our 50th anniversary next year, and through the work that we've done, I guess we were ideally placed to step into the arena when antimicrobial resistance campaigns really started to get going. I was the president of the society about 5 years ago, and am now the director of public and professional engagement. In answering the question about what we could, the single most effective thing to do, I mean, I think I also would draw on the access versus excess argument, and clearly one major strategy to reduce use of antibiotics, or reduce inappropriate or unnecessary use of antibiotics, is to prevent infections occurring in the first place. So I guess if I had to choose one thing that we could do, I would say provide clean drinking water to the world's population, because that way spread of infection will be dramatically reduced.
Perfect. I think that's a pretty good one. Thank you. Now I'm going to hand over to our final speaker, Adam.
Thank you, Rhiannon, and thank you for the invitation. It's a pleasure to be here. So I'm Adam Roberts. I'm a reader at the Liverpool School of Tropical Medicine, and we've got quite a broad portfolio of activity in the AMR space. We have individuals, including myself, that look at transmission, mechanisms and evolution of AMR. We've got a diagnostic unit, which is working towards diagnosing AMR and bacterial versus viral pathogens rapidly and at the bedside. We have a lot of work in capacity building in country through the Fleming Fund as well. And we also have quite a large drug discovery and development program aimed at looking for not only antibiotics, but also anti-insecticides and anti-parasitic molecules as well. We currently have large MRC funded One Health projects in both Malawi and Uganda, looking at the full range of drivers of antimicrobial resistance. And to answer the kind of fun question with the magic wand, so to build on what other people have said, mine would be truly magic, because I would stop bacteria being able to evolve resistance. And then we would not need another one of these next year.
I like that. Thank you. Okay, so thanks so much all of our speakers for introducing themselves and for being here and for giving us a nice idea of the landscape that we're looking at when it comes to AMR. Of course, as the speakers have already highlighted, there are still a number of quite big challenges and obstacles when it comes to overcoming the health problem of AMR, and there's still a lot of work to do. So Sian, I wonder if we could start with your perspective as a policy advisor, and what do you see as the main barriers faced by people working in industry, research, health? From your perspective, what do you see as the big blockers to progress that are the bottlenecks here?
So probably the first thing that sprung to mind here in terms of barriers was thinking about that list of different organisations you've just given us, is really the sort of connectivity and coordination between all of those groups. So as we kind of touched on today, there's no one organisation or no one topic or area that has the full mandate or responsibility to tackle AMR. And it's not something that we're going to mitigate effectively without having action in all of those places and bringing all of these people together. That's obviously a huge challenge. And actually, even beyond the organisations that you've named, there's even more relevant actors in other places where we might not usually think of them, in what we often call AMR sensitive fields. So things that kind of touch on and relate to AMR, but we don't necessarily think of as the main pieces when we're thinking of how we tackle it. So for example, wastewater treatment companies and people looking at medicine quality, all these things like that. So we'd have to bring in all of these different dimensions to really have a proper comprehensive and One Health response as well. So that's a big barrier in sort of bringing all of these groups together, making sure we're working together, pushing in the same direction. And I think within that, another big challenge is that a lot of these groups don't even speak the same language in many ways, especially if you're working across very different sectors, say human health and environment sector. So there's even challenges in just getting people to sort of participate on the same level sometimes. So that's a big challenge there. And I think sort of reflecting on this as well, it can even be an issue within stakeholder groups. So if we're thinking about the UK and how they bring together their national action plan, or any other country. It's how you bring together those different departments, even across one government, to sort of agree on what they can do and how they piece it all together in a comprehensive and sensible way. So there's definitely things that we're doing really well on that front, but there are definitely still challenges, particularly in bringing in certain players, certain groups. So I'll leave it there, but that would be my first challenge.
Yeah, I think that's a really good point about, especially what all the speakers have just said about the different areas that they're working on. So to zoom in on a specific area, I was wondering if, Suzi, as you know, said your organization's been around for 10 years. Could you give us a sense of the challenges in agriculture and farming in particular?
I'm going to have to go, Rhiannon. Sorry.
That's fine.
Thank you very much. Excuse me. Bye-bye, everybody.
Bye. Thank you so much, Lord Cheese. Thank you for joining.
Yeah, I think the challenge is globally the scale of the problem. I mean, it is almost can feel a bit impossible when you look at it from a global perspective. I mean, obviously, our campaign focuses mainly now, especially because of Brexit, on UK policy, and actually following directly on from what Sian has said, and a bit of Lord Treese's introduction, there have been really significant reductions in agricultural use of antibiotics in the UK in the last 5 years. And that's been led by the industry itself, the farming industry itself, not necessarily being led by the government. And actually what we would really like to see is someone in government with a position that is One Health for AMR, because at the moment it is spread across so many different departments. I was actually quite pleased to see that the APPG on antibiotics wrote to the Prime Minister earlier this year asking for a minister of that position. And I'm not sure if they've had a reply yet, but we would also like to ask for the same thing. So in the UK, I think there's a bit of a leadership gap. So we have done really well with our reductions, but we're just about to come up against some really significant challenges in how we produce food and how we procure food, in light of how our subsidies are changing and how our trading landscape is changing. So our farmers are going to find themselves in a very different position, and there's not necessarily a regulatory backdrop that will keep a level playing field and that will help them to maintain the really good progress that they've had in the last 5 years. So I think the UK has some very specific challenges linked to leaving the EU, and obviously COVID hasn't helped, has it? Yeah, we've got quite an uphill battle to do with food standards and regulation coming over the next couple of years.
Perfect. Yeah, and I think we're going to come back to upcoming challenges in the AMR scene over the next year for the UK a bit later. But Chris, I wanted to ask you in particular, so you've worked a lot with low and middle income countries and One Health and farming practices across the world. What's your perspective on the challenges in other countries as compared to Europe and the UK when it comes to agriculture and farming?
Yeah, well, I think the biggest challenge in other countries is that there are still plenty of countries that allow to use antibiotics as growth promoters for farming. So that's a big issue because it's if the governments aren't putting any policy or regulation about that, it's going to be really difficult to control the problem. And actually, it's potentially can affect the UK because obviously we are trading food all the time, and there are obviously regulations of what the animal products of animal origin have to follow, but still that's the main bacteria, or the main strains of bacteria that are evolving and developing resistant are coming from low and middle income countries. And with international travel, well, this bacteria it's able to reach countries like the UK that may have a good starting point with regulations and policies, and definitely is going to affect that. So the UK support, it's for LMICs is pretty important.
Yeah, and I think building on that, I wanted to pick up on something that actually Nick Brown said in his introduction. I wanted to get your perspective on how kind of a more holistic picture of health that looks at quality of life fits into the challenges that we're facing with AMR, not just with farming, but in the way that we ask people to take care of themselves and their families and their health systems. So I just wanted to pick up on what you said there and see what your thoughts are on the challenges.
Yeah, well, I think it's pretty important, because actually the concept of health in One Health is not just the absence of disease, but it's actually absence of disease and also welfare. But we actually are looking at health most of the time like absence of disease. But we know that AMR is a problem, not just because people can get sick, but for example, in low and middle income countries, we know that there are plenty of people that work with farming, that these animals are their source of income. So they depend on these animals to live. And if this, and AMR is affecting them hugely, like it's unbelievably, because they are not just at risk of getting a resistant bacteria, but also they have to put more money into treating their animals to get better and to not be sick. So this is very important, and I think if we don't look at this problem as something that goes beyond medicine, we will be not solving anything any soon.
Yeah, so you've touched on, I think, the socioeconomic consequences of AMR for lots of communities. Nick, I was wondering if you could come in on some of the socioeconomic causes of AMR. You mentioned water in your introduction, so I'd be keen to hear what your thoughts are on that.
Absolutely. So well, we know from the issue of One Health that many of these factors, be it in the environment, in the bug, in the settings that we're treating infection, are all intertwined. So we don't have time to go through that in great detail. But I think one report perhaps to highlight published today is the UK's SPOW report. SPOW stands for the English Surveillance of Prescribing and Antibiotic Utilisation and Resistance. Not terribly catchy name, I'm afraid, SPOW, but that's freely available on the internet, and that goes through some of the initiatives within this country anyway, to try to improve surveillance of resistance and antibiotic use. And that there are some sort of headlines from that certainly in we've talked about the reduction in antibiotic use in agriculture and in veterinary medicine, but I don't think many people appreciate that 80% of antibiotic use in human medicine is in the community. I think people often think that it's all to do with prescribing in hospitals. But that means that antibiotic use by the general public and prescribing by general practitioners is a huge issue. Likewise, dentistry. The dentists have been fantastic in reducing antibiotic use. In fact, the use has gone down by about 50% in the last 5 years. But use where it is not needed is a key issue. Conversely, use in hospitals is actually going up at the moment. And in particular, use of very broad spectrum antibiotics, the ones we particularly want to protect, is going up. And that is more of a concern. And so I guess the point that I would like to bring out from this, in terms of all the strategies that we have to control antibiotic use, is that actually one of the key bits is the implementation. I mean, having a strategy is fine, but the difficulties we're having, I think, is getting over that next hurdle. How do you actually implement those changes? And that clearly involves a lot of hurdles, some financial, some behavioural, and clearly there are lots of others as well.
Thank you. And I think that one area that we haven't touched on yet, but I'd quite like for us to go into, which Adam mentioned in his magic wand of not letting bacteria develop resistance in the first place, but once they do, we do need some new antibiotics to help tackle them. So Adam, what do you see as the main challenges when it comes to drug research and discovery and the pharmaceutical industry on this issue?
I think the problems associated with antibiotic R&D can be broken down into two major sort of umbrella areas. One is human capital. So there's probably about 400 to 500 individuals on the planet at the moment who have the scientific capability in order to bring a drug all the way through early stage development to market. I am not one of those, by the way. I don't have that skill set. This number is reducing year on year because people are retiring, and it's not really seen as a very good career option. So less and less people are going into it. So unless we get a handle on antibiotic R&D very soon, we're going to reach a critical point where we're going to have to relearn and make the same mistakes again, how to develop an antibiotic from scratch. And that's the situation we want to avoid. And then probably the main barrier I can see in bringing new antibiotics to market is the market itself. So everybody's discussed about the broken sort of pipeline, the fact that it's not being filled. And if there is a new antibiotic developed, the companies such as Melinta, Tetraphase and Acagian are actually going bankrupt because they can't sell enough to recoup their costs and make a profit. And this makes a ridiculous landscape for a business who need to make a profit to please their shareholders. So quite often pharmaceutical companies are painted as the villains because they're not in this actual field anymore, or most of them aren't, and they've all left. But actually, if you're running a business, I don't think you should be expected to do something which is going to lead to catastrophic loss of that business, because then that business won't be viable and all of the medicines that they do produce won't be produced anymore. So it's kind of a self-fulfilling downward spiral if we expect antibiotics to be produced for free by commercial enterprises. There are other private-public partnerships such as GuardP, which I think are doing a fantastic job at the moment of sourcing funds and outsourcing the development of antibiotics. And then there's also the completely public model, which I think needs a lot of exploration. Okay, we've seen how much money the government is able to find and spend on PPE, for example, which is not fit for purpose. Okay, there are tens of millions of pounds of PPE sat in warehouses. I think it might be an idea if we could channel some funds into a institution or a centrally funded series of research projects looking for new antibiotics. Even if they don't and they won't all produce a new antibiotic, the science that we gain from them will tell us what we don't do next time we look. And this has got to be an ongoing thing. If you leave it to academia, it won't work well because people have to keep getting grants, and then you get the experts. Actually, what they're doing is not the science, they're just writing grants and trying to get those. If you do it the pharmaceutical companies, then the end market has to be fixed. It could be argued there shouldn't actually be a market for antibiotics. They should be a public good and provided at cost, planet-wide. So all of these things need to converge into a suitable number of solutions, and they're not mutually exclusive. It doesn't have to be one or the other. And because of the human capital aspect, we're running out of time, and these can't be tried out sequentially. So I think they have to be tried out in parallel.
Thank you. Yeah, I think that was a really good overview of the problems with incentivizing research and development with volume of sales and profit alone in the pharmaceutical industry. So I think moving on to kind of what we can be pushing for, like what sorts of things should we be pushing for and advocating for as young health professionals? So Sian, obviously you do a lot of work on this topic exactly, advising people. So what commitments are you pushing people to be making on AMR when you have these discussions with decision makers? Yeah, so if you could give us some highlights about what you're asking people to do, that would be great.
Sure. So, I mean, our remit is quite wide ranging, but I suppose one piece that we're doing quite a lot of work on is around sort of effective global governance for AMR. So global structure that will allow us to collectively work on this issue. So I'm not sure if people might be familiar with the outputs of the Interagency Coordination Group for AMR, which came out, I think it was, if it wasn't last year, it was the year before, that were sort of had this specialist group come together and talk about what's needed next to really move the needle. And we advised on was that we have a more formal structure collectively as a global community to rally around this particular issue. And I think sort of implementing some of the outputs in that report have been quite slow, but there's a potential of having a structure that we can get around that would really help us move things on. So things like having a formal secretariat and having formal scientific advice that feeds into that, and sort of high level strategic leadership as well. So that's one of the big pieces that we're working on. I suppose the other thing I was thinking about when I was thinking about this particular question is not necessarily just the what we're asking people to do, because that can often be very specific, very tailored to particular people we're speaking to, but there's also a big issue of how people make that happen. And I think it was Nick that mentioned this earlier, is that we get a lot of inaction around AMR, and we make a lot of plans, but sometimes we feel like we've not got a lot to show for it. We haven't really got very far in actioning those plans. And actually there was a piece of work that came out this week from Wellcome. It was published on Monday as a landscape analysis of the AMR space. And one of the key findings that we took from that is that there are so many potential actions, potential policy commitments that people can make, that sometimes that can be quite paralyzing. So too many different sectors, too many things that we can be doing, and actually that halts action rather than helping us really make some progress. So I think one solution and sort of an approach that we can take in how we try and make policy commitments is to think more about prioritization. So recognizing that there are lots of things that we can do, but appreciating that we can't do all of them at the same time, and we need to start somewhere. So can we do more as a community to really think about prioritizing the things that we know might be helpful? So for example, possibly starting with the things that we know might have the biggest impact or are most readily kind of accessible to us to make happen. And then also thinking about sequencing. So prioritizing, but also putting those things in a constructive order. So what are the things that have to happen first that will then lead us to be able to do sort of even greater things further down the line? So yeah, I think it's not just a question of what, it's also a question of how we make it happen. And there are sort of other factors behind that as well, to do with making sure our national action plans are fully financed so we can actually make them happen, and sort of the great power of political will as well for actually making some of these things happen. So sorry, I've maybe strayed off the question in terms of the exact nature of what, but I think that how factor is really important, and that's something that Wellcome is also not just thinking about what the actions are, but also how we can encourage people to actually get things to happen.
Perfect. Yeah, no, I think that was you answered a better question than the one that I asked. So thank you very much. So I think I really liked your point about political will and about pushing through these plans. But I think, as most of us are aware, the political landscape across the globe is in quite a lot of flux at the moment. So I'm going to ask Suzi and then Chris about the roles that UK foreign policy and domestic policy has on this issue. So first I'm going to go to Suzi, and I'm going to ask kind of what are the key areas to watch in UK policy related to AMR and One Health that are coming up, that people who care about this issue should be watching?
It's a very good question. On Friday, the tripartite, which is the FAO, World Health Organization, and the OIE, is announcing a global leaders group on One Health for AMR. So I look forward to knowing more about that group, because apparently there's some very powerful people on it. So hopefully that is a good, it's a step in the right direction. And the next thing I would like from a UK policy point of view is to replicate that here. So the EU has a One Health plan. It would be great if the UK could establish something like that. We also do have Dame Sally Davis, who was our Chief Medical Officer, is now the UK Special Envoy on AMR, which is she's done such a fantastic job, I think, really helping to promote the UK as a world leader in AMR on the world stage. And it would be so good to replicate that back here, particularly because of the troubles, like the perceived problems that we think we may be about to face. So joining all that policy up domestically would be a really good move for us. And I think the next thing that we've really got to be looking for policy-wise is what's going to be happening in these trade deals, because the UK has done some really good work, and a significant number of people are really concerned that our farming community is just about to be completely undercut by imports from other countries where they're not taking the same kind of action that our farmers are and producing to really different standards. And we're just about to put a report out about some of the quite significant malpractices of some very large exporting countries that we're currently in trade talks with, because we're about to lose our main import block, which is the EU, where we got the vast majority of our imports from, and we're a net importer of animal produce. So what we're about to, what we could potentially be bringing in is something on a very different quality level to what we've been used to, and particularly as the EU in 2022 is banning the routine preventative use of antibiotics in groups of animals. We're potentially about to see quite a significant shift in our global standing for standards in antimicrobial stewardship and use from a regulatory point of view. So yeah, there's quite a lot in the balance at the moment.
Thank you. Yeah, that was a really good overview. And on a related but slightly different topic, Chris, you've worked a lot in low middle income countries and on their policies. So as the UK is looking to help countries and to work with other countries, what do you think it should be doing to try and help other governments to tackle this issue in an equitable way?
Yeah, well, I personally believe that the UK has made big efforts to support some low-income countries in their fight against AMR. Like actually there are different funds for students and research projects supported by UK organizations and institutions. There are different institutions in the UK receive fellows from some African countries to receive specialized training in AMR and diagnostics research. And also there are plenty of UK researchers collaborating with researchers from LMICs. I think that's a good starting point. I think it's important though to be sure that the efforts are directed to build capacity in other countries so they become independent and can look for ways to implement and test their own measures in their own context. Because we know that context or settings can influence the outcomes of solutions implemented. So it's not just creating something in the UK and then replicating that there, but actually that has to be measured and that has to be adapted to their own reality and see if that works for them, because we work in different settings. So I think that's something that the UK has to be sure they are doing.
Great. I think, yeah, that was a really good point, Chris. We've got a couple of really interesting questions in the chat. So before we go on to kind of concluding remarks about what young professionals and especially members of Students for Global Health who are hoping to go into issues of global health and One Health, yeah, I just wanted to take a couple of issues from the chat. So the first one is one that I got sent privately, which is, what do, to all panelists, what do you think the role of strengthening health systems is more broadly in tackling AMR? Anyone is welcome to take this one, otherwise I'll pick on one of you.
Rhiannon, perhaps I could come in here. I mean, I think that it's a very important question, and we've already touched on the excess versus access debate. But clearly prevention of infection is absolutely critical to preserving the use of antibiotics into the longer term, preserving what we've got, if you like, which is the other side to stimulating the development of new antibiotics. And if people don't get infections, then they do not need antibiotics. And so therefore antibiotic utilization goes down. So I think, I mean, the issues will obviously vary from country to country, depending on the health system and depending on the infrastructure in the particular country. But building up health services globally is an absolutely key area of antimicrobial resistance management, I think.
Thanks. And there's also a discussion going on in the chat, which I'm trying to keep up with at the same time, about the role of doctors and health professionals. We've talked a lot about interventions from the kind of the government and the regulatory and the investment level. But what do you see as the role for doctors and vets and health professionals in pushing this agenda forward? So yeah, anyone who wants to take that one.
I could just comment quickly on there's just been an update, I suppose, on the veterinary side about how the people who are actually on the ground doing it are going to be contributing. The new targets that were announced today for the 2021 to 2024. So those are the targets for the UK to reduce antimicrobial use in animals. They've set a target to include in all veterinary courses basically guidance on stewardship and responsible use, which is something that wasn't there before. I think it was a sort of on-the-job learning. So now it's going more properly into the courses. I don't know how they're necessarily going to monitor that, but it's a good intention anyway.
And Adam, from your work in the field, have you seen any kind of like some great leadership from healthcare professionals, and what did that look like, if so?
Yes. So one of the things that we've seen recently from work by one of our students is on delayed prescribing in Ghana. And this has really been adopted by the pharmacists rather than the healthcare workers within the hospitals. And it's had great success in reducing the numbers of prescriptions that have been picked up from the scripts that have been written with virtually no adverse effects. So most of the infections were self-limiting. So this looks like a very simple intervention that could be rolled out far more nationally in an international way. But importantly, it was driven by the healthcare professionals and the pharmacists within that particular context. So it was context specific. It didn't come top down, it was from within. And I think that's why it works so well.
Perfect, thank you. And I think kind of to wind up, I'd really like to get the speakers' different perspectives on where young health professionals and where, you know, aspiring global health professionals fit into this picture. So I think, who will be my first victim? Sian, if you have any kind of advice to people in the audience who, you know, really care about this issue, but, you know, are also at school or trying to juggle 100 other things at once, where do you think are the key areas where kind of young and upcoming health professionals should be looking to influence?
Definitely. And yeah, I think it's one of the challenges where sometimes it can feel very overwhelming and there's lots of things out of our control, but actually sort of remind everyone that there are actions that we can take on individual levels wherever we sit, whether we're working in the health sector, a related field or not. There are still things that you can, as an individual, can do. And so I definitely encourage people to, you know, once you're aware of this issue, to really think about steps that you as an individual can actively take. So things like committing to using antibiotics responsibly for yourself, speaking to other people about that. I think certainly young professionals in the space have a lot of opportunity to really champion the issue. Like you're saying, we need more leadership, and I think need more perspectives from people working in the area to kind of point out where particular challenges that they face are being seen. Otherwise we won't be able to address those. So just reflecting on the last question as well, there was one project that Wellcome recently ran, sort of trying to use human-centered design to create tools for prescribers. This was in a couple of low and middle income countries, but tools for prescribers for them to you know, support their prescribing behaviors and use antibiotics less. And that was really reliant on working with those doctors, but not just doctors as well. So also thinking about wider people who provide or interface with the use of antimicrobials in different ways. So also nurses and pharmacists, and then people in animal sector, environmental sector. It's really about those people coming to the fore and sort of talking about the things that that are particular challenges for them. So we have this sort of bottom-up approach rather than just the top-down, which I guess we know from many other fields is just not so effective. Probably a very last comment as well is in the spirit of the One Health discussion, for people to also think outside of their own silo or their own box. In a lot of meetings I go to, we talk about breaking down silos, but I'm not sure we ever do it that effectively. But if, you know, we can bring in people who have this broader view, who can see this as a system and sort of relate to sectors outside of, say, the one they work in or the one that they study, then we can really link things together in a truly One Health approach.
Incredible, thank you so much. I think that was a really great overview. Would anybody like to go next? Just like a quick reflection on where you think young health professionals should be looking.
I can do it just a 20-second because I know time is very short, but I would perhaps also emphasize the importance of political engagement. We've mentioned the APPG, the All-Party Parliamentary Group on Antibiotics already, and my society provides the secretariat for that. So we organize the meetings that they have. And a quick story recounted by the chair of that group, who's an MP from the Yorkshire area called Julian Sturdy, who recounted that we were very chuffed that last year we got a backbench debate in Parliament on antimicrobial resistance. And I think about 8 people turned up. And immediately after that, there was a debate on cycle lanes and the House was full. And Julian pointed out that MPs are bombarded by emails about cycle lanes, and therefore they take it very seriously in their constituencies. And clearly the lesson that we took from that was that they need to have more emails from us to prioritize antimicrobial resistance. And you might call it the Marcus Rashford effect or the Greta Thunberg effect or whatever, but that's how things get done if you want political engagement.
Thanks. Yeah, and well, that's very useful, I think, to us as a distributed network. We have access to rather a lot of MPs, so that's a very good take-home point. Adam, do you want to go next?
Just to reiterate Nick's point there, really engage with your MPs. They have to respond. We pay their salary, we elect them, and they work for us. And it's a really important point. But as a kind of a message to the student body here, become a leader in the field really quickly. So we've talked a number of times about the lack of leadership, both sort of politically, but also scientifically. The leaders in this field are getting quite old, and we need the next generation of researchers to come in very fast and take up the mantle. There is a lot of space, there's a lot of work to do, and this issue is not going to go away. So if it's something you feel strongly about, you can make a career in it.
Incredible, thank you. Chris, would you like to go next?
Yes, well, I think as a student, the fact that you're promoting this type of events is a pretty powerful tool to spread the word about the problem. I think also maybe you could plan some outreach activities where you are also providing some information to the community or schools, where you can in simple words explain the problem of AMR. But let's don't forget, when you do that, that AMR is not just about antibiotics or interventions to tackle AMR is not about just not taking antibiotics. In fact, last year, the World Bank classified AMR interventions in AMR sensitive interventions and AMR specific interventions. And within AMR sensitive interventions, they included interventions that are directed to